Thank you. My name is Ashley Valentine. I'm co-founder and president of a sickle cell advocacy organization called Sickle. And Sickle is co-founded by myself and my older brother, Marcus. And thank you for your condolences. My brother, Marcus, passed away on June 22nd. He was 36 years old with sickle cell disease. His vision for Sickle was we got to get the story out there because, as we mentioned, sickle cell is an invisible disease, but our community is suffering. We talk about the progress we made here, and this is historic to be speaking to officials at this level because the reality is we suffer. We suffer every day. What you see here is not what happens in our households. So we go out into the community and we interview sickle cell patients and we put their stories next to their faces. Because what you don't see is in order to get Marcus to a conference, he had to go to his cardiologist, he had to go to his pulmonologist, he had to go to his respiratory therapist, he had to get blood draws, blood gas, he had to take an enormous amounts of pain medications because the reality was up until last year we didn't have treatment options. So our pure goal is to make sure that the patient voice is heard and that it's clear so that we can eliminate stigma and improve the quality of life for people living with sickle cell disease. So a little bit about my family. My brother Marcus was 36 years old. He had sickle cell disease, hemoglobin SS, and he had a pretty severe form of sickle cell disease. But our story starts way before that. Both of my parents have sickle cell trait, but my dad was tested 2 times and told that he did not have sickle cell trait. My oldest brother does not have sickle cell trait, and I don't have sickle cell trait either. They didn't know that they were carriers until Marcus was born. Unfortunately, that's a norm. Many people have sickle cell trait and do not know they have sickle cell trait until they have a baby with sickle cell disease. So our household was full of joy, but we really tried to live in between the crises. And what that means is we would play violin in the city of Chicago because we were next to the Children's Hospital. And the Children's Hospital was so much fun. I was the princess of the playroom. I would make pottery and I would get to meet celebrities. But what was happening in the next room was that Marcus was being put on ventilators because sickle cells were clogging his lungs and putting him into acute chest syndrome. Or he was having to get blood transfusions or blood exchanges as an infant or a toddler because his hemoglobin would rapidly drop to a 4. Fortunately, he was put onto hydroxyurea, and that brought his hemoglobin from a 6 to a 7, and he didn't respond well to hydroxyurea. In 2015, Marcus developed sepsis, and he was very sick. He spent 6 weeks into the hospital, and I was called home because my mom said he might not make it. You have to come home. And during that hospitalization, we saw infectious disease specialist. He was in ICU. We saw every single doctor under the sun. The sepsis had broken down his bones, and it caused him to have avascular necrosis in both hips. So he was on his way to get hip transplants. And many people with sickle cell will tell you that they've had their hips replaced. During that hospitalization, after all of that, he was still accused of being a drug addict. During that 2015, he looked at me and he said, something has to change. Something has to change because we need to be seen as individuals that need help. We need to be seen as a community that has been forgotten, that has been discriminated against because of the color of our skin. And adults need to be we need to remember our adults with sickle cell disease. Our children, if we can mitigate the disease in childhood, then when children become 25, 30 years old, maybe they won't have as much pain as my brother had living all these years. On top of the physical pain, financially, sickle cell devastated my family, but we've survived. Our house has been foreclosed 3 times. I've lost my job once. My mom has had $0 paychecks working for the federal government because all of her paychecks were going towards the insurance. My dad has accepted layoffs because he needed to take Marcus back and forth to the hospital. And employers, quite frankly, don't understand or care about sickle cell. So when you say, my family member has sickle cell, they tell you, well, someone I know had cancer. Maybe they'll get better. And the reality is we live with this every day. So I'm here today asking for awareness, and thank you so much for allowing us to be here. We have 4 new drugs to market right now, and we're excited. We're so excited, but patients still can't access them. My brother was enrolled in the free drug program because insurance denied the brand new treatment for him, and my mom still had to take off a day of work in order to work with the company to get him enrolled in the free drug program. My brother was on hydroxyurea, he was on Indari, he was on Voxelotor, and he was just about to start Adakveo the day he passed away. We had to fight with insurance for every single one of those new treatments because they denied us. Outside of the new treatments, they didn't understand his other conditions, so it was important that we advocated as a family. So the work that you've done out of the Office of Minority Health, and thank you, Admiral Gerard, is monumental for sickle cell, but we need to make sure that the conversation here makes it to the patient population, and the urgency is real because our friends are dying from this disease. Thank you.
Thank you, Ms. Ashley, and sorry, my deepest sympathy for your loss. And thank you for advocating. Very important.